Hello, so this is Chapter 10, Evidence-Based Practice in Public Health Nursing, and it really would have been better if we had done this at the very beginning when you were planning your presentation program, because we're going to talk about gathering the evidence in the PICO question, and that would have helped you to define your population and your intervention and things like that. So we have our objectives. We're going to see why we're not using evidence-based practice. We're going to talk about what it looks like in public health nursing. So we use it at all levels, and we don't reinvent the wheel. We're nurses. We use the evidence. We see what has been studied. We see what the evidence or the research says. We then adjust it for our populations. We implement it, and then we evaluate it. But we really need to be sure that we're not doing individualized care, that we're thinking about population-focused care. And so I think that's where this need for evidence-based guidelines in public health comes in. So you can read this and understand that this judicious use of evidence means that we're not just saying, well, we saw this study and we're going to use that evidence. We have to look at the sample and what was done and how it was decided and where it was and is it generalizable. So we have to understand the evidence, and then when you've been working as a public health nurse, you have to use your own expertise for what you know of your population. And so if I was working with 90-year-old frail elders in their homes, I would have that evidence of what I knew happens in their homes because I've been visiting them, what their health issues are, what their health risks are, what their safety risks are. I would have that expertise of working with them and my experiences with them. And using all of this along with the evidence is how I would then read the research studies to say, oh, this is a rural population. This probably wouldn't work because my people are urban and their issues are very different. Their exposures are very different and things like that. So remember, and you've learned this, that evidence plus clinical expertise plus experience is helpful. And so also in that expertise, do you need to call in a nurse practitioner or a physician or a physical therapist also to use this evidence? Excuse me. So you will make your question, you will look for the most current evidence. Remember, it's the same as you've studied in research, last 5 years. You have to have the ability to interpret the meaning of the evidence, so you need to understand the parts of a research study, how to critique that research study, to be able to say, yes, this sample is very similar to my population. I'm going to look at this closer. This would probably work. This solution, this program that's being implemented, I could gather that. I could read the statistics. I can see these results are generalizable. Time restraints for your program. If you have a short grant or you have a grant that wants results, you're not going to do a 2-year study. You might have to do something that's a little bit quicker. But understanding these resources that are available, the practice characteristics, again, is it urban, is it rural, is it frail elders, is it 65-year-old elders? Everything is a little different. Am I a school nurse? Then I'm not dealing with not frail 90-year-olds, but maybe some grandparents are a part of that, so I have to think of my practice. Links to outside supports. Are there other people to consult with that could assist me? Are there political restraints when we look at what's happening with the children being taken from their parents at the border? there's political constraints on what public health nurses would be allowed to do. Are they allowed to go into view? There's reports that there's no touching of the children. These are under that political constraint, which would have to be considered. And then, is there public health research that would help my practice? And that is a topic that public health nurses are concerned about. So the steps is to develop your habit of questioning what's happening in your practice, and you can do this when you're on the floor as professional nurses. You want to formulate that question. What is going on here? In this group, what is happening? Then you want to look in the literature and see what research studies have been done, what clinical papers have been done, what qualitative studies have been done. Remember to use a variety of literature to search it, and then you're going to appraise that literature. You're going to critique it and use what is best with what you know about your population. You're going to integrate the evidence with your clinical expertise and your client's values, implementation, in other words. Then you're going to evaluate. And again, as we are doing in our presentation, everything is evaluated in nursing practice, from the individual patient's result of pain medication delivery to large population samples, million hearts, screenings and things like that. And then once we have those results of the evaluation, we're going to disseminate it. We're going to talk with our colleagues. We're going to present it at conferences and programs, and plan your program would be for others listening to you because you've already done your program. So remember the PICO question, and the P stands for the patient, the population, or the problem in public health. I know it was more limited for you in your research for your clinical class. The I stands for intervention or item of interest, which could be an exposure, a treatment, a test, or a program. And then the C is the comparison. If there is a comparison, a lot of times it's to do something or not to do anything, and that would be not having something to compare it to. And then outcome. What is the outcome of your that you're looking for, that you're studying for? So you're going to write the PICO question for public health, and you're going to say in the population with this problem, or in the population in this program, or with this risk behavior, or with this exposure, or a population dealing with this policy or with this medication. Does the intervention that I'm planning, more than the comparison, if there is any comparison, result in the outcomes? So let me give you an example. So if I was working with as a public health nurse in a clinic, I might ask this question in an area where a lot of women were smoking. In women who are post-menopause, does smoking cessation programs, more than continuing to smoke, result in decreased bone loss? So we know that smoking affects calcium, which affects bone health, and we know that women who are so women who smoke may go into menopause earlier, and then they are exposed to bone loss longer. But we also know that the first few years after menopause is when there's a more rapid bone loss than later on. So we would want to attack the smoking behavior that they're doing, and see if that slows down their bone loss. In another example, we could say in men who own farms, and work with pesticides? Does the use of personal protective equipment more than regular farm clothing decrease pesticide poisoning? So the question would be, should we be giving farmers and telling them they should be wearing protective equipment so that they decrease their risk for poisoning? So in that case, in this PICO question, the exposure is the problem, where that asterisk is. So that could be a question about exposure. So again, you can do it for your population in your community. You can look at your community problem, evaluate the data that you have, the research, the statistics that you're collecting, identify gaps in knowledge, and then look at the studies, look at the risk and benefits to the community of picking one study over another, and then look at how the ethical situations, the political situations, the economic, what are those factors that you have to consider as part of your experience in the community related to this public health issue. Again, you want to assess the health issue, make your question, search the literature, evaluate the evidence. Is the sample similar? Is the intervention similar? Is the outcome the same outcome that you're looking at? Then you want to plan and implement your program, and then evaluate your program. So, as you can see, this is not most likely going to be on the final exam. I wanted you to understand its use as you pull together the information for your presentation. You can think in terms of that, what is the problem you're looking at, which I think all of you have put on your outline, and then look at the evidence, the 5 articles you're responsible for presenting, and then plan your program and present it. So I'm going to do Chapter 28 in a separate presentation. Thank you.